If you've been dealing with nagging back pain that just won't go away, I've had that before, especially pain that feels stiff in the morning or it just keeps coming back, you might be wondering, is it because I'm getting older or could something else be going on? I'm Dr. Barasali, a rheumatologist, and in this video, we're diving into what causes back inflammation, especially in people with rheumatoid arthritis, ankylosing spondylitis, or even in those that haven't been diagnosed with anything yet. If you've been told that your back pain is just posture, wear and tear, or a part of getting older, stay with me. You deserve the full picture, and then you can make a decision. Let's start by talking about inflammatory back pain. What is it? Because it's very different from the kind of back pain that you get after a long day on your feet, walking around Disney World, or even from sleeping funny. This specific type of back pain is often worse in the mornings, like when you're resting. It tends to improve with movement, and it might even wake you up at night. With this type of back pain, sleep can be tough. 3 a.m., 4 a.m. seems to be the time where you're just kind of uncomfortable and you're stiff and you're woken up because of that. Inflammatory back pain is this kind of slow, stiff, deep kind of pain. Not the sharp jolt of like a pulled muscle. It's a little different. If that sounds familiar, you're not alone. A lot of people are living with this, thinking that it's normal. But it could be a sign of something more, and that's where we're going to dig deeper. If you already have rheumatoid arthritis, you might be wondering, can that cause back pain? Technically, RA usually affects the hands, the wrists, the elbows, knees. It can be in other areas too, but not a big cause of low back pain. But that doesn't mean that your back pain is unrelated. Many people with rheumatoid arthritis do get back pain from muscle tightness, deconditioning, even having fractures in your spine. Osteoporosis is more likely when you have rheumatoid arthritis. Compression fractures in your spine can certainly hurt. Or you could have accompanying osteoarthritis, which is the degenerative arthritis, the wear and tear. So it may not be inflammation directly from the rheumatoid arthritis, but it still needs attention. How about ankylosing spondylitis or axial spondyloarthropathy? Yes, it's kind of gotten this new name, and this name is not any easier than it was before. In fact, I feel like it's a little tougher. But that aside, these are forms of inflammatory back pain that start in the spine. Usually symptoms begin before the age of 45, but you could be a little bit over 45 and maybe you've had these symptoms for years and they just really weren't picked up upon. But usually it tends to happen in a younger population. But this is what makes it tricky because it's a younger population. Oftentimes this back pain is dismissed and people will say it's mechanical, it's lifestyle related, you picked up something wrong, you shouldn't have been carrying all those boxes in from the garage. Many people, especially those without any obvious x-ray changes, they can get misdiagnosed or told that it's just aging. But if you've had low back pain or even buttock pain, right, just either in the right buttock or the left buttock, or it can alternate. If you've had these complaints and it's lasted for months, worse in the morning, gets better with movement, and it just won't go away, it's worth looking into AS, ankylosing spondylitis. And it can affect people of all genders, often hiding in plain sight. When you look at the textbook example, it's often a male of Caucasian background in their 20s. No, ankylosing spondylitis can happen different people, different genders, different races, and again, maybe just in front of you. Okay, so how do you know if your back pain is inflammatory or maybe just wear and tear? There are a few tests that can help. An x-ray to start with, but if that's negative, then an MRI can give more information, especially an MRI of the sacroiliac joints. They're kind of in the butt region, and if there is some abnormality with those, that can determine if you have more of an inflammatory process. And remember, you can often find things in the MRI before the x-ray shows anything. It's just, you can pick up things earlier. But yes, it's expensive. Insurance doesn't always cover it unless there are suggestive symptoms. You have to be suspicious for this type of inflammatory process, or it may never get picked up. There is a gene test. It's called HLA-B27, but the problem is not everybody has it, and you can have the gene and totally not have inflammatory back pain, or vice versa. So it doesn't mean everything, but it could be worth checking. Blood tests like the C-reactive protein or the ESR, also called the sedimentation rate, they can help spot inflammation. But more than anything, it's your story and symptoms that really matter. Don't wait years to get an answer. If something feels off, talk to your doctor, see a rheumatologist, and find out if it's inflammatory or not. Because there's lots of medications now that can help. Whether your back pain is due to RA, AS, or another inflammatory condition, there is actually good news. Back when I first started practicing, I could count on my hand how many medications you could actually use for inflammatory back pain. But nowadays, there's so many more choices, whether it's anti-TNF agents, JAK inhibitors, IL-17 blockers, and there are others. They can target the inflammation and help you feel better. But if you've ever watched my other videos, you know that I'm a big believer in lifestyle. Here's what helps. Number one, movement. Regular movement, especially mobility-focused exercises like yoga, stretching, walking, they can all be really helpful to kind of get those joints moving. Anti-inflammatory foods, I have many videos on this. Think turmeric, omega-3, berries, leafy greens, and strengthening your core back muscles with gentle physical therapy, and also learning the kind of movements that you shouldn't do, the jerky movements that may be worse for you than it would be for another person. There are some sports that you have to be very careful with if you have these inflammatory back conditions. And stress and sleep, because they definitely play a role in how your immune system functions, and they can help keep the inflammation calm. The best approach to keep inflammation in check combines both of these: targeted medications, but also the daily habits that can keep everything calm. This is all to say, don't just settle for being told you're just getting older. Now that might be the case, but not all back pain is the same. And not all of it is caused by aging. If you've been dealing with pain that's more stiffness in the morning, gets better with movement, and has been lasting for months, it's time to get evaluated. It could be your rheumatoid arthritis, or it could be axial spondyloarthropathy, ankylosing spondylitis that's been overlooked, and maybe your diagnosis was a little bit off. Because sometimes when people come in with just initial joint pain, it's hard to tell, especially when you have something like seronegative rheumatoid arthritis or seronegative inflammatory arthritis, where the physician suspects that you have an inflammatory process, but they're not quite sure in which direction it's going to go. Definitely worth a reevaluation, because getting the right diagnosis can make a world of difference. If this helped clarify things, give it a like and share it with somebody else who has back pain. I share videos on autoimmune health, inflammation, and how to feel your best as you age. Have you had back pain like this? Drop a comment. I'd love to hear your story. And if you want to hear more about ankylosing spondylitis or inflammation in the back, you can check out this video right here. See you next time. Dr. B with Plant Forward MD.